Let's talk a little bit about your cancer battle first.
Sure.
For people, I'm sure a lot of people have been keeping up with you, but just for people who don't know, this is kind of your second round with it?
It is. I was diagnosed in May of 2016 with stage 4 cancer, the first period of my liver, and we fought it very hard for 6 months. The Rockefeller Cancer Institute at UAMS is amazing, and with the aggressive treatment, we shrunk the tumors down, and they actually went dormant, which is very rare when you're talking about stage 4 cancer. And so I had 9 months with no treatment. And then in August, they reappeared, some tumors started reappearing in my lymph nodes. So we're doing a second round of chemo, and we're just fighting away.
Exactly, yeah, and we're all here with you.
Yeah,
I can tell you that.
Thank you. I appreciate it.
Of course, and then, yeah, you were saying that you had a very busy last week. So Friday you were doing chemo, and then what, you got on a plane Saturday?
Actually, well, Monday I got on the plane.
Monday.
Yeah, it was kind of out of nowhere. I had I met a friend online, as you do when you're a cancer patient. You meet other cancer patients online. She, in the middle of last week, was blocked by the president on Twitter for some comments that she made. And she's also a stage 4 patient. So I retweeted her, her message out, and she reached out to me, and we became fast friends. Because again, someone else with stage 4 cancer, you know each other's language immediately. And so CNN reached out to her about being a part of this healthcare debate. And her name's Laura Packard. Folks might have seen her on some cable news shows, but she couldn't go because she had chemo on the day of the debate. And so she recommended some other friends to CNN. One of the producers recognized my name because I had dealt with her when I was in the governor's office, and we started talking, and they had me submit some questions, and they called me Sunday and said, can you get on a plane tomorrow and come to DC?
All right, well, yeah, we actually have your question too. So here's what you had to say during the CNN town hall that night.
Why don't you think we see more in the Senate and the House gravitating toward the middle and looking for these type of consensus solutions instead of staying on the sides and just letting the current administration chip away and destabilize the system that a lot of us are depending on to live right now?
Okay, so Bernie Sanders replied to you that he didn't think Medicare for all was some sort of radical idea. And then we also heard from Bill Cassidy, who was then arguing in support of his bill, of course, saying that, innovative states like Arkansas should be given the flexibility. So that middle ground that you were asking about, what do you see that looking like?
Well, I see it between, it all come down to making the Affordable Care Act better. Senator Graham was being a bit disingenuous with his answers and talking about things, because he would talk about Arkansas and rightfully praising the innovation that both Governor Beebe started and Governor Hutchinson has continued with the private option, and then Arkansas works. Well, Louisiana, he talks about the terrible premiums people have in Louisiana. Well, they didn't take the Medicaid expansion. They never actually fully implemented the Affordable Care Act. So they refuse hundreds of millions of dollars from the federal government and then say it's a disaster, which is, unfortunate. And of course, what Graham Cassidy would have done was take a bunch of money from states like Arkansas that did expand Medicaid and shift a lot of it to other states. So we would have still had the structure in place, but with a lot less money. I think that you can make some fixes to the Affordable Care Act that you can do to improve insurance markets. We are very lucky in Arkansas, because of the steps that we took, that you have a lot of options for insurance. In fact, I had to change insurance last month right before I started going through treatment again. And all through that process, of course, it's a lot of paperwork, no one said cancer even once. The subject never came up because it can't come up. But of course, before that, the system was about pre-existing conditions, and that's where a lot of things would have gone under Graham Cassidy, where eventually states would have been put in a position where they couldn't cover pre-existing conditions the way that they would want, because the money just wouldn't be there. I think if you can take some steps to improve the insurance markets nationwide, and not just in the states like Arkansas that have done it well, and you can do some work toward prescription drug costs, which again, all the senators there that night were very much in favor of, and make some other mechanical tweaks to it. I think that you can have a system that's more stable and more functioning, and then look at what the next step is. A lot of people talk about getting costs down, cost controls. And that's one thing that when I was in Governor Beebe's office, there was a lot of dissatisfaction with the fact that the Affordable Care Act was passed without first getting costs under control. And that's still something we need to deal with, and it's something we've been working on, again, in Arkansas for about 5 years now. So I think that, if they can start in the middle, like Senator Alexander and Senator Murray did, and if you can build a coalition to make some smaller changes, I think you can make it better for everyone. But I also understand the politics of it, and that there's a lot of Republicans who have been saying for 7 years, we're getting rid of this. And that's where a lot of them have been focused.
And let's talk about your former boss a little bit. So, you know, Graham and Cassidy and many other Republicans have been calling Obamacare a disaster, but Mike Beebe essentially said the opposite with Graham Cassidy calling it a disaster. And so moving forward, as a cancer patient, you said you had to switch your insurance just a month ago. I mean, how do you feel that you're being protected and covered?
Right now, I feel like I'm being protected pretty well. My premiums are not cheap. They could be cheaper, but they're the same premiums I would have if I was the very healthy person I was until I was 41 and a half years old. And, you know, I spent I think I'm an example of how the system does work and sometimes should work, in that I was a very healthy person, paid a lot of money into the system for 2 decades, and then when I needed it, through, you know, no action or act of my own, it was there for me, you know, and took care of me. And I think that's what we need to make sure is still part of it. And you do need that buy-in from younger people, from healthier people, who a lot of times, of course, when you're younger, you feel invincible. You know,
right.
I'm healthy, nothing's going to happen to me. Well, you never know. And, you know, take it from me, you never know. And I think that the more that the national system can look like what we have in Arkansas, because I had multiple choices from multiple providers. And there's a lot of states and a lot of counties and states around the country that don't have that right now because their state didn't take Medicaid expansion or other actions that have been taken by their state governments. And so, you know, I think that we continue to be a model in Arkansas of what we can do. And I know that the legislature and Governor Hutchinson have been working to make some additional tweaks and further adjustments to the program. But when you're talking about something as big as healthcare, of course you're going to have changes and adjustments over time. It's not something you just put in place and then, you know, we're done. It's always going to need adjusting, but I think the steps can be a lot smaller to do a lot of good for more people.
And we just heard from Senator John Boozman earlier on the show saying that, you know, Republicans are not giving up. We're going to get this done this Congress. Do you see that happening?
I mean, your guess is as good as mine. We 4 times this year, I think, or at least 3. Yeah, 4 times this year we've had, you know, this effort, and then everyone's like, well, that's dead. It's gone. You know, dead on arrival, all these medical terms, and then, of course, 2 months later, it's there. Obviously, it's tougher now that we're into October and we're past the budget reconciliation process. So if the U.S. Senate wants to get anything passed, they need 60 votes rather than 50, and they haven't been able to get 50 to this point. So, you know, if nothing else, hopefully that will drive folks a little closer into hopefully bipartisan efforts and hopefully finding the places where you can make some changes that satisfy both bases.
Yeah, and with tax reform looming, you know, we have a
what
lot
do for a
to
while,
look at.
Yeah, absolutely.
Well, Matt, thanks for joining us on the show.
Anytime. Thanks, Jesse.